Yeah, very good evening to all of you. So, on behalf of Indian Association of Physiotherapists, I would like to extend a warm welcome to an international speaker, Dr. Sundar Balasubramanian, for accepting our invitation and giving us consent to deliver a talk in spite of his busy schedule. So thank you very much, sir, for joining us. And you being the inaugural speaker, I think with all your blessings, the whole conference is definitely going to be a great success. So I would like to officially introduce the speaker before we proceed. So just give me a second. So to know about the resource person of the day, he has too many titles and too many achievements on his board. So I have just picked very few things for you all people. Dr. Sundar Balasubramanian is a cell biology researcher at the Medical University of South Carolina, studying resistance to cancer therapy. He is an inventor who connected breathing exercises with salivary biomarkers, pioneer of clinical utility of regulated breathing exercises, author of groundbreaking books in yogic breathing, and a passionate educator. He is also a yoga biologist and founder and director of Prana Science Institute. He's a pioneer in the area of salivary biomarkers combining pranayama practice. He was a speaker at TEDx Charleston in 2015 with 7,30,000 views. I think this is long back, taken long back. And he recently received the J.C. Bose Memorial Award by the Indian Science Monitor for his yoga biology research and dissemination. He has authored 3 books: Prana Science, Decoding Yoga Breathing, Mind Your Breathing, the Yogi's Handbook with 37 pranayama exercises, and Murattu Kudurai 37 Kadivalangal. His audio albums include Chanting is Pranayama and Kandar Anubhuti. His keynote address today will provide an theoretical and practical insight into pranayama. The attendees will be able to get acquainted with the key exercises from pranayama tradition and their relevance to well-being in modern times. So with this small brief introduction about a very great renowned person, I now leave the floor to the international speaker to start, and now the platform is all yours, sir. Thank you.
Good evening, everyone. Let's start with an invocation for the Guru. So let's take the blessings of the Siddhars, the ancient scientists of our land. தெளிவு குருவின் திருமேனி காண்டல் தெளிவு குருவின் திருநாமம் செப்பல் தெளிவு குருவின் திருவார்த்தை கேட்டல் தெளிவு குரு உரு சிந்தித்தல் தானே. தெய்வ திருமூலருடைய திருப்பாதங்களையும் எண்ணற்ற சித்தர்களுடைய அடிகளையும் போற்றி இந்த உரையினை தொடங்குகிறேன். It's a great pleasure to be here. First of all, I would like to thank Dr. Rajan Samuel, the organizer for this conference, and the student who was introducing me, Kishore Saravanan. I hope he's there in the audience. He was the one who introduced me to Dr. Rajan Samuel and then talked about his research, and he's very passionate about pranayama. So this tells us very important thing about the recent changes and how pranayama is kind of coming up as a way of not only a tradition, not only a practice for personal use, it is also something that people are looking forward in a professional way, especially in the integrative health world. So that's something that I wanted to share with you all today. As Mr. Rajan suggested, I am from the Medical University of South Carolina, working on cancer therapeutics. I will be talking about that a little bit. And most of the time, the plan for today is that we will be talking about the basics of pranayama, what we have done in our lab, and how we are using that in the clinical practices, and what is the future looking like for the pranayama. So that's the thing that I wanted to just cover in today's talk. And we'll have the question answers at the end of the session. So please keep your questions and we will definitely discuss them. Okay, with that, let me go ahead and share my screen with you. Great. So this is, as I mentioned, this is going to be about how the yogic breathing can be a potential adjunct for various symptom management. So we are talking about several chronic illnesses and acute problems, how we are going to use pranayama in this current scenario, especially now we are in pandemic. And as people always say that the relaxation is not for the virus, it is only for the people or the regulators. So it is up to us to take care of our immune system, up to us to take care of our patients. So in that way, it is very important to use all different sorts of tools that we have to achieve a good health. So I hope by the end of the session, you will be able to take some, information with you. I'm working in a project that involves how cigarette smoking is important important modifier in cancer therapeutics. We know very well that smoking is bad. Smoking causes, there are 6,000 compounds in cigarette. And when we are exposed to either first-hand or the second-hand smoke, or it can be regular traditional cigarette or surutu, or the modern days, the electronic cigarettes, how they all can change the therapeutic response. So if you think about if a patient going through either cancer radiation, chemo, or surgery, any type of therapeutic approach, the therapy response is very drastically modified in the predominant amount of number of people because of the exposure of cigarette smoke. So because the cigarette smoke exposure, it has like 6,000 compounds, it can change the cellular behavior, cellular machinery. It will make certain cells really hard, especially cancer cells really hard. So it will be very hard to kill the cancer cells after its exposure to cigarette smoke, because the nicotine improves the survival of those cells. It also helps the cells to kind of go to different places, metastasis and secondary cancer in different places. All these complications are there because of smoking. So I always say smoking is bad. So we try to understand the molecular mechanisms of those and how genetic elements are involved in that process. That's my other passion, the research area. So today I'm going to talk about yoga. So yoga, as soon as you think about yoga, some people think it is not my type because I'm not flexible. I cannot do yoga. That's what people, you probably heard people saying. And when we also think about people who are going through certain life-changing situations, or people who are bedridden, normally in aged population, all those people may not be able to do some of these yogic breathing, the asanas. When we think about yoga, people always think about postures, right? Asanas. Not asanas are not for everyone. Therefore, we have the Ashtanga Yoga tradition, the 8-limb practice. So everyone in the Ashtanga Yoga tradition can use some practices from the tradition. So it starts with the Yamam, Niyamam, Asanam, Pranayamam, Pratyagaram, Dharani, Dhyanam, Samadhi. All these 8 types of practices are kind of put together in the Ashtanga Yoga tradition. So in this Ashtanga Yoga, through this tradition, one can kind of feel that their presence, experience their presence, or transcend in their nature in through 5 different layers. So I may be thinking that I am the body. You may be thinking that the breath is the important thing right now. The most aware thing that I'm experiencing is my breath, or I'm completely in the state of mind, or I'm having a very deep contemplation, thought process, where I'm getting newer ideas, or going beyond all these layers into the state of ananda, the bliss. So a person can be in any state. You can transcend from one state to through the other. And the transcending towards the inner self, the realization of the inner self, or being in the ananda, the blissful state, is the ultimate goal of life, if we speak, or to keep every single layer healthy and happy, to live a peaceful life, happy life. Health is wealth. So it is important to understand what are the different ways in which you can organize these 5 layers in a healthy manner. That is what is showing in this area. The 8 different practices can keep all these 5 layers happy and healthy. That's what the yoga tradition is completely about. Especially when you think about pranayama, we all breathe, right? No question. We all breathe, but at the same time, we don't control the breathing. When we are able to control the breathing, when we are able to regulate, right? புறப்பட்டு புக்கு திரிகின்ற வாயுவை நெறிப்பட உள்ளே நின்மலம் ஆக்கில் உறுப்பு சிவக்கும் ரோமம் கருக்கும் புறப்பட்டு போகான் புரிசடையோனே. This is Tirumantaram. Tirumantaram talks about several things, like there are 1,000 poems. I will be talking about that a little bit. But specifically on pranayama, the air goes in and out without our knowledge. You don't care whether I'm breathing, whether I'm focusing on it or I'm regulating it or not, it's going to go in and out. Why do I bother? Right? That's the common thinking. But once, if you are able to regulate breathing, if you're able to change it, if you're able to hold it in or out, or different types of breathing exercises, 50 of them, you can bring in a lot of changes in your mind and the body. Because in the previous slide, I showed you here, so the vital sheath or the pranamaya kotam is in between the physical sheath and the mental sheath. So it is the bridge between the physical and the mental sheath. If you're keeping your breath, if you are able to regulate your breathing, you will be regulating the mind and the body. You probably heard several times when you are in a stressful condition, what do people tell you? Take a deep breath. When you are taking a deeper breath, your body is adapting to a newer homeostatic state. Your mind is coming to a balanced state. There's a lot of science behind it. It's an autonomic response. Breathing is an autonomic response. But when you regulate it, when you slow it down, you're kicking the parasympathetic nervous system, or the predominantly the relaxation response. Whereas when you're stressed out, when you're breathing fast, you're activating the stress response. The stress response can affect your immunity, affect your memory, your physical condition. So when you're stressed out, what happens? Your heart goes fast. Your circulation is impeded. Whereas when you're relaxed, your heart is low, nice and rhythmic, and your brain functions in a better order. Higher order brain functions are stimulated with the breathing. So that's why it is important to do breathing exercises. That's what our tradition is. Like our ancient siddhas have found all these methods for people to regulate their breathing and live a long, healthy life. But in these days, with the stressful situations or lifestyle, we don't care about our breathing. The breathing goes on just the shallow. We don't take a deeper breath. Our breathing is fast. So it is important to understand that slow breathing or regulated breathing is very beneficial to the mind and body. It's bottom line. Then it is also very easy to practice. You can practice in any place. I can just drive to my work doing a pranayama exercise. I can work in my lab doing a pranayama. You can walk, run, do any type of activity. You can do pranayama. And there is a breathing exercise practice for every single activity you can think of. So pranayama is very easy to practice. You don't have to be a certain body type like people sometimes think, which is wrong. Even for asana, anybody can do asanas too. What is important is that when we think about patient population, it is important to, kind of address their needs. Think from their perspective. What are the exercises that will make them feel better? So these are the main criteria for me to take into the pranayama as my research area. So as I mentioned, Tirumantaram is the book that I value so much in my life. Tirumular, which is the saint that wrote that. Saint Tirumular and Saint Patanjali, along with 6 other masters, saints. They all studied under one master called Nandi. So this was said by Tirumular himself in his poem. So they are all contemporaries. There are 3,000 poems in Tirumantaram. You probably know this already. It is a lifelong project to learn all the 3,000 and understand the meanings, not just one meaning. There are several meanings for each poem. Understand the meanings of those. And the 4 chapters that are 4 major areas of Tirumantaram, I just wanted to mention that Sarya, Kirya, Yogam, and Jnanam. Sarya, anything that we do with the body. Kirya, rituals, different types of activities. And Yogam is the type of the Atanga Yogam. This Atanga Yogam is just one yoga. There are other types of yoga, Kesari Yoga, Pariyanki Yoga, other types of yoga also there. And then Jnana, the search for true knowledge, like through the way of self-inquiry. So all these 4 pathways are explained in Tirumantaram. And very interestingly, all the 4 pathways are using one common technique that is called the breathing technique. So in all the ways, in all the 4, throughout Tirumantaram, you'll find at least 285 songs, poems that are related to pranayama. So there is a chapter on pranayama inside yoga, but there is the poems related to pranayama or the breathing regulation is spread throughout all 4 disciplines. What does it tell you? Whether you are engaged in Sarya or Kirya, Yogam, Jnanam, breathing is an important tool. That is the tool that you want to hold, whatever may be your path. There is no other common denominator in all these 4 pathways. Maybe there will be bhakti or love. Love is the biggest common thread. I cannot say there is no other thread, but beyond something that you can regulate is the common one is the breathing. One poem that kind of draws you into the pranayama is the chapter on pranayama. It's the first one. ஐவர்க்கு நாயகன் அவ்வூர் தலைமகன் உய்யக் கொண்டு ஏறும் குதிரை மற்றொன்று உண்டு மெய்யற்கு பற்று கொடுக்கும் கொடாது போய் பொய்யரை துள்ளி விழுத்திடும் தானே. This is about how the relationship between mind and your breathing. So the mind is the master. Mind is the master of all our senses and the whole body. And mind cannot kind of be reached out directly. You cannot reach the mind. You cannot control the mind directly. But mind is traveling on a horse. The horse is the breathing. So that's here, the breathing, and this is the mind. So when you want to control the mind, you cannot control the mind directly. But if you control the breath, the rider, the mind, will be controlled. So it is very easy for everyone. So you don't have to be a seasoned practitioner of yogi or bhakti marga or any other type of seasoned practitioner. If you in this second, if you think you want to change your breathing, you will change your mind. It's a very, very big assertion that's given by confidence, given by Tirumoolar. If you think that you cannot control your mind, don't worry, control your breathing. It will control your mind, especially for the students who are here, youngsters. I will definitely vouch this method. And when I was reading, this is the major poem that I will be talking about in our research exercises, is that the Tirumoolar Pranayama, where the inhalation, holding, and exhalation are timed. That is based on Tirumantaram 568. ஏறுதல் பூரகம் ஈரட்டு வாமத்தால் ஆறுதல் 64 கும்பகம் ஊறுதல் 32 ரேசகம் மாறுதல் 1 பஞ்சமாமே. This is an important poem that tells you the sutra, the specific calculation of the nostrils, of the timing, everything involved in it. And when you do the exercise in that manner, there are so many things that are happening in your body and mind. One thing that happened was salivation. So as I said, parasympathetic activation or the relaxation response will stimulate, you know very well, physiotherapy. Like when you go through a physiotherapy or massage, what do you feel? Salivation, improved salivation, lacrimation, urination, digestion, defecation. All those things are stimulated by the parasympathetic activation. So the salivation was improved when I was doing this exercise. That's what is leading to the identification of molecules, potential molecules that could be activated in the saliva or expressed in the saliva. So what are the different molecules that are expressed? The nerve growth factor, the first protein that was probably, identified in the saliva that is related to the nerve growth. It's a nerve growth factor. It has also very prominent role in cancer as well. So this is an important protein for the growth and survival of neurons, nerve cells, all over the body, not just the central nervous system, it's a peripheral nervous system everywhere. And whenever there is a less amount of nerve growth factor, there will be cell death, neuronal death, that as if it happens during Alzheimer's disease or in other neurodegenerative diseases. Very interestingly, for this group, the stroke recovery. So stroke recovery is also dependent upon amount of nerve growth factor and the family of neurotrophins, like the nerve growth factor, BDNF, GDNF, all those things can be kind of contributing to the recovery after stroke. So this is an important molecule that is expressed in the saliva. So we first wanted to see whether there is an increase in nerve growth factor in people when they practice this Tirumoolar Pranayama. So what we did was we did a trial with people starting at this time 0, 5, 10, 15 and 20 minutes. You'll have saliva collected each 5 minutes and then tested for nerve growth factor. The first 10 minutes was pranava pranayama, the chanting of the Om, and the second 10 minutes was the Tirumula pranayama. And as you can see very well here, so in the chanting or pranayama group, you will have that 17 kilodalton protein expressed in almost all the people that after in this particular group. So this is the first time that, whereas in the control group, you don't see any of the nerve growth factor in that molecular weight region. So this tells that pranayama or breathing regulation can be a factor that will quickly change nerve growth factor as little as 20 minutes. Right? This was published. You can, if you go to my website, pranascience.com, go to research, and you can download these articles and read it. And the next set of exercises or the studies that we did was using mass spectrometry in the salivary proteins before and after exercise, before and after the Tirumula pranayama. What are the different proteins that are expressed? So we found 22 proteins that are actively differentially expressed. You see that the proteins that go down are proteins that go high. So these proteins, if you look into some of the proteins, you'll see that immunoglobulin, Ig heavy chain, mu chain, alpha chain, and all the 8 different classes of immunoglobulins are going up. And some of the proteins that go down are these alpha 2 macroglobulin like protein or different. The keratin, I wouldn't worry too much about keratin because keratin is in skin and everywhere that could be a thing. And glyceraldehyde 3-phosphate dehydrogenase, GAPDH, or cystatin B. These are molecules, like for example, the cystatin B, they are involved in some stress regulation as well. And some proteins like the kallikrein that you see that's increased, this is also very important in maintaining your blood pressure. And proteins like the prolactin-inducible proteins, so these are tumor suppressors. And you will have other tumor suppressors like deleted and malignant brain tumors, DMBT1. And mucin, proteins like mucin, the cellular or the mucosal membrane proteins that will line up the membranes, mucosal surfaces. All the different proteins are kind of going up and down in the saliva. So what does it tell you? So it's a breathing regulation is kind of, it changes the biology at the cellular level. At the cellular level, there is a differential expression of proteins. We can see how proteins like aquaporin. So when it is in stimulating salivation, means like there should be more aquaporin, the pores should be opened and there will be more water exhalation. So those type of reactions are stimulated in this particular scenario, and that brings in a lot of molecules, different salivary proteins and so on. So DMBT1, I mentioned it's a tumor suppressor molecule. It's deleted in malignant brain tumors, not just in brain tumors. Now it's found in other areas like lung, breast, prostate. All different cancers have this protein deleted, which means that in all those cancers, the cancer cells don't want this protein because this is a tumor suppressor. You don't want the suppressor to be present in the tumor cells. That's why the tumor removes that protein so they can grow faster. So here, what we are doing with the pranayama exercise, you're stimulating the tumor suppressors. So that will create a situation where there will be like cells that are malformed or having defects in their cellular machinery, they will be deleted from the system. So it also has very large domains that will be key for the binding of different bacteria, viruses, including HIV virus. And it's very interesting molecule with a lot of different binding modules that will be important in immune defense. And it is expressed in saliva, tears, breast milk, GI, genital, pulmonary tracts. What does it mean? it also has a protective role in all the mucosal surfaces. And as I mentioned that the salivation lacrimation, the L also stands for lactation. So when people are more relaxed, that lactating mothers, when they are relaxed, they will be able to produce more milk. So that's why our system has, like the culturally, every culture has things like lullaby, talate. So these are the things that are indirectly regulating our breathing. Okay, so DMBT1, if you look into in the control saliva, there is not any detectable expression by this method, but the same method could detect a very high expression of these DMBT molecule with time. So as little as 5 minutes, you have a good expression, 5, 10, 15 in many of these individuals. So what you can see is the densitometry. As soon as 5 minutes, you have a good amount of expression, significantly increased amount of expression of this molecule in saliva. We also tested other molecules like the IGLC2, the immunoglobulins. When we are talking about immunoglobulins, I want to bring in another important view right now. So with the pandemic going on, what investigators from around the globe has identified is that our immunoglobulin heavy chain gene can be, kind of selected, chosen from about 48 different genes. So they all code for the immunoglobulin heavy chain gene. So there are 10 of them are very prominently used. Of those 10, we have 2 of them already expressed because of the breathing exercises. So it is not necessarily that it is going to bind to COVID-19, so not like that. It is kind of the type of heavy chain that is used in response to the viral infection could be stimulated by relaxation response, could be stimulated by pranayama. So all these immune response elements are there as part of your innate immune defense. And it will be kind of useful to have them, stimulate them at times like this, so you will have enough immunity. And the next set of exercises we did was that, what are the different types of cytokines? So you have the white blood cells, they produce the cytokines or the interleukins. They will communicate through these chemical messengers. And it is important to produce these cytokines during an infection or for the trafficking of the immune cells from one place to another place, and for the important regulation of the immune response. So we will not be having an overt immune response to our self-antigens and so on. It is important to have the cytokines or the activity of these white blood cells kind of to be subdued when we do not need them. So if you don't want that kind of the fire alarm going on or the ambulance is running all the time, you want them only when you need it. So in that sense, you do not want to have that stress response on all the time. But what happens in the controlled situation in normal people? There is quite a high amount of IL-1 beta, for example, this particular stress response cytokine. It is involved in various inflammatory diseases, and it is an important one in the induction or the perception of pain and mediator of stress. And people now block IL-1 beta using antibodies, FAB fragments of antibodies that can be kind of bind to the IL-1 beta and neutralize them away. But what we show here is that when you do the breathing exercise, you reduce the amount of IL-1 beta. It's a very interesting scenario, exciting data, because what you found in the other slide was that you see the list of proteins. What you see here is that proteins like mucin or proteins such as the prolactin-inducible protein, these proteins are large molecular weight proteins that have many different domains. As I said, not just the viral protein binding, bacterial protein binding, they also can bind to small molecular weight compounds. So they can kind of sequester them, put them away when we don't need it, and then it can be released later by proteolysis of the activation of proteases in the cellular extracellular matrix. So that kind of a system is there, and that's where probably the sequestration is happening. When you do the breathing exercise, you stimulate some of the large molecular weight mucin-like proteins. They will take away these IL-1 beta-like molecules. It happens very well for IL-8. And this also, like in attention control also, there is a good amount of reduction in, as soon as when people start doing their control maneuver, which is like sitting quietly and reading. What does it tell you? Even if you are able to sit down, read quietly, you will be able to bring in some changes in your body. Your body will go to kind of a relaxation mode, but yogic breathing is a little bit more prominent in bringing in other changes like IL-1 beta, IL-8, and so on. And this happens with the MCP1, it's a monocyte chemotactic protein 1. This also is involved in inflammation, heart diseases, PTSD, Alzheimer's, and so many other things. And people have shown this gene expression at the level of gene, it is also reduced in upon the practice of any yoga and so on. So it is important to understand this basic. There is a change in your biology at the molecular level. There are specific molecular pattern that is changing when you are engaged in a breathing activity. So that's what we showed. These are the things that we showed for the first time. So that there is we know very well from our ancient tradition that people always say it is good to do the breathing exercises. It is important to change the breathing, but we do not know why is that good? What happens in the system when we do that? Earlier studies show that there are so many newer experiments done in terms of neuronal changes or the changes in the blood gases, changes in the other psychometric indicators. So everything is now kind of put together in the molecular level. And what we know from, I wanted to just give an kind of overview of how things change when we are doing these exercises is that when you are doing the breathing exercises, you're changing the factors inside your body. And it can be kind of transported through the retrograde axonal transport to different parts of the brain or the different parts of the system. Central nervous system, or it can be just kind of protective to the oral or nasal mucosal surfaces, and it can be absorbed through the sublingual route to other target organs. So there are so many ways in which these factors that you are just producing in the saliva. It doesn't mean that it's there only in the saliva. It will be in other places too, and it can get transported too. So we are using this. I will just wrap up quickly on the uses of these in different areas. So in cancer, we tested it in cancer patients and caregivers that are undergoing cancer treatment. And we provided 20 minutes of breathing exercises on a weekly basis, and people liked these exercises. They experienced improvements in terms of stress, pain, mood, appetite, or sometimes they feel like the burden, reduced burden, all those different types of perceptions or the patient-reported outcomes. These are important in human research. And what the overall satisfaction of these classes, very satisfied, most of them, majority, 91% of them are very satisfied, or some people are somewhat satisfied with the classes, because satisfaction is number one, right? So if you're providing an intervention and if people are not satisfied, there's no use of that. So you had to measure that satisfaction. And then also, how do you want to continue that practice? So if they are here for 2 weeks, 3 weeks, 10 weeks, then they go home and they forget it. So it's not useful. So they want to continue the exercises at home. So you have all the materials or other helps that is available. So when you have that, people will be definitely interested in continuing the practice, right? And so we also had that how the cardiopulmonary rehab, this may be very interesting for this group. So taking a little bit step back, so the cancer, because of the treatment modalities, improvement in detection, treatment, there's more number of cancer survivors now. So there will be more and more cancer survivors. People living with the cancer will be very high. In those cases, all the, they cannot be just on the medication alone. You have to give them all the other support, integrative medicine. So that's why in Tirukkural we have a Tirukkural in Marundu Adhigaram. Utravan Tirpan Marundu Uraicelvan என்று அப்பால் நாற்குற்றே மருந்து. 4 things are important for medicine. So that the patient, the doctor or whoever is in the care team, and then the Marundu, the medicine itself, whoever is in nearby, the support system. So all these 4 things are important for the successful medicine. That's what the integrative medicine is now, kind of the approach that we are taking care of people. So the pranayama is definitely one of the components in the integrative approach, because we use this as part of the Survivors Fit Club program at the Medical University Wellness Center. And we provide yogic breathing, exercise, nutrition, and psychological counseling. So all these things come together along with their radiation therapy or their other types of therapy, chemo or other surgery. So everything combined together with social support like Survivors Fit Club or the community, the family, everything has to be together in that healing process. The same way, cardiopulmonary rehab, after 3 weeks of surgery, patients can go through, do some of the breathing exercises. Definitely, there are some exercises that can be easily done to make people feel relaxed. Those type of exercises, you have to be specifically using the techniques, right techniques, right? So it's very important. You can use that for people with hypertension in a community setting. That is probably people with low income and high blood pressure, diabetes, and all the things that are kind of, it's also related to the disparities in health, like how one type of people in the low income, people belonging to certain social denomination, they get lower quality of healthcare. So how those people are, affected by these, by the lack of facilities in those communities, we can use. We have used these breathing exercises and then asanas to see some indications of how that is important in lowering some of their blood pressure values. And VA, so the Veterans Affairs, just like our veterans everywhere, the Army veterans are going through a lot of emotional or mental health issues, and we are kind of providing these classes on a weekly basis at 2 different locations. One is for the mental health inpatients, and the other one is in the pain clinic. And we can use this along with many of the standard of care treatment, like the prolonged exposure therapy or cognitive behavioral therapy. So many different types of can be combined with the breathing exercises. And there's also there's another condition, many other conditions where, like for example, scleroderma. When we provided these classes in a larger setting, conference setting, people really enjoyed that 1 hour exercise, and then they really felt that it is personally beneficial. So based on these feedback, we are now running a clinical trial for scleroderma, where the gentle yoga and yoga breathing could be useful for their symptom management. And it is also useful in aging community. We did a small pilot study. It's currently going on. There's another grant that we are working on. So it's where there is usefulness of yogic breathing along with the other therapy methods. And we can also use it for employee wellness because every employer will want their employees to be happy. So we provided these employee wellness series for our MUC staff. What we found was that people who took these classes, like over 200 people attended those 3-month session every 15 minutes, those sessions. They said, yeah, would you recommend these sessions? People responded to yes, which means that they like it. They want their colleagues to know about these exercises. And it is now available throughout our MUC intranet website. They can go in there and then practice. And when you practice, they get extra additional health points. So it's like getting some reward. So that's a way it is. Like so they said they will utilize these yogic breathing exercises, a majority of them, or some maybe, and there are some people that said no. So that's how the human research is always. And as I mentioned, scleroderma, aging, Healthy Charleston Challenge. This is another weight management group where yoga breathing is very important, and physician resilience, like when you are thinking about doctors who are going through the burnout. So there also it is very useful to use some of these methods. So just to summarize, we have these yoga breathing or the pranayama can stimulate different types of changes in your saliva or the whole system. And these differential expression can have an impact on the immune system or the nervous system. And it can be a systemic change all over the body. And it is also, it's very easy to deliver, give it to patients, train them very easily, train the trainers very easily. And people do accept these. They're very satisfied. They think they can do it. They need support for the continued practice of these. And it is feasible in hospital or community settings or in individual practices. And for example, or the wellness industry. So everywhere. So I just wanted to thank my collaborators or my colleagues at MUSC and radiation oncology, COBRA that funded some of them projects, and another lipidomic COBRA. I didn't present the data on this yet. And this is the Pure Action. They supported me for the cytokine research, and Gases Cardiac Research Institute. That's where I started these studies. Now I'm in the Hollings Cancer Center, ECHO staff there, and Hope Blood staff, cardiopulmonary rehab, VA, and there are so many other people that I don't have time to thank. But just I wanted to thank you all for your time and attention. And I just wanted to mention that Prana Science is the first book. This has the 14 poems from Tirumantaram explained, and I have put some of these information in this book, so you can, it's available on Amazon in India, everywhere. And the second book was Mind Your Breathing. So this is the exercise book, which has 37 pranayama exercises you can practice. I'm actually teaching one exercise per week for people who are joining me very early in the morning, 5:30, I believe in our time, 5:30 a.m. That's yours, probably 8 o'clock in the evening. Maybe, I don't know, maybe 3 o'clock in the afternoon on Sundays or Saturdays. That is the 37 pranayama exercise. I wrote that in Tamil also, Murattu Kudirai Kumpathiyelu Kadivadangal, pranayama Paichi Kaiyedu. And recently, if I could move this, there is this little Hindi thing. So that's a translation now. We have the same book in all different flavors if you're interested in. And with that, I thank you so much for your attention. I thank you, the organizers. I thank the organizers. Thank you, Dr. Rajan. And thank you, IAP India. And thank you, Kishore Saravanan, and all the students, especially for your interest in pranayama. I'll be happy to take any questions.
Yeah. Thank you very much, sir. It was a wonderful session. I think so. We got the message like by breathing, you can balance between the mind and the body, and definitely like the horse we have to control to reach the mind, and about the all the scientific evidences you have for the pranayama exercises in improving the nerve growth factor, tumor suppressants, and all the scientific evidence is really going to help us. So in all our patients whom we are dealing with, I think definitely we have to implement and keep doing more researches so that more people get benefited out of this pranayama exercises. And I would like to share my witness as I am already practicing this pranayama. So I definitely feel very good. I get more circulation coming to my brain, and I can feel the freshness in my face every time. I definitely get the salivary secretion every time. And the most important thing is like once I do this pranayama, what happens is like I go into meditation. So it's really literally difficult to open your eyes. Every time I go do this pranayama, then I really find it difficult to open my eyes. I can feel some vibration. I can feel that I'm receiving something from above. So like so it's my personal witness, and I request all of you to really take this message, practice for yourself to understand the effectiveness before you deliver it to somebody or the patients who are in need. Thank you, sir. I think we will go with the question session. Uh,
I see. So do you have other questions from the other areas? I can go through the chat questions here, right here.
sir,
So how to
so,
instantly reduce severe headache using pranayama, as it is very common in people so this mainly, oh good, so you have a, so the headache, it's, what is the cause? Noi nadi, noi mudal nadi, adu tanikum, vai nadi vai pichel. So what causes the headache? It may be, so we have the 10 vayus, dasa vayu, it's circulating in the whole entire system. So they all have to be nicely balanced throughout the system. So if you blink, that's one vayu. And then when you hear, when you sneeze, cough, everything is a different type of vayu that is acting in the whole entire system. So what happens in the sedentary lifestyle is that we are kind of blocking all of that. Like we are holding tight, right? Even when you're sitting, I'm sitting here for the past 1 hour. So when I'm sitting, I'm just restricting my movement of those vayus. So what I should do is that sitting is like new smoking. So you have to get up and walk every maybe 20 minutes, every half an hour. You have to get up and walk and move the air around. When you move your muscles around, you move the air around within you. And the pranayama is a great way to bring balance in all the different vayus. And when you do the practices regularly, so that is one way of reducing the stress, balancing the whole system, and digestion. So you have a lot of things that are taken care of. So the headache could be caused because of stress, because you're looking at the screen for a longer time, or there is a gas issue. So all these things can be kind of normalized, brought back to the proper homeostasis when you're doing regular practice of pranayama. So as I mentioned, there are, it is it's an ancient practice for people all times. Like modern humans are not so modern. Like we haven't changed so much in 5,000 years. So it is important to, you can easily use some of those methods. Of course, there are so many different methods from very different schools. You can use any of the method that is suitable for you. Um, And there is Tirumantaram. So Tirumantaram explains. So the Tirumantaram again, it is Tirumantaram was written by Saint Tirumular. It has 3,000 poems, and Saint Tirumular, Saint Patanjali, they're all from the same master. And Tirumantaram has 4 different chapters. I mentioned it. It's 9 major area, 9 major chapters, I would say, 4 different areas that is focusing, or 4 different paths for enlightenment. You can get enlightened either just by doing what you do, and but it has to be kind of a liberation of your. It should be towards liberation, not just being as kind of a slave to anyone or a subordinate to anything else. There shouldn't be any oppression in the system. So you should be kind of you can be liberated in all the 4 different paths: Sarye, Kiriye, Yogam, and Jnanam. In all the 4 different pathways, the breathing is the common thread. And talk about Tirumantaram itself, it's a very, very huge topic. And I'm clearly not an expert in Tirumantaram, but I'm trying to learn as much as possible. There is a lot of poems that are specifically related to pranayama, specifically related to how the different energetic channels within your body, different chakra systems, how the energy moves through different chakras are nothing but the nerve plexus that are arranged all over the body. And those are the main important areas where you can bring in changes. Now we are talking about the nasal cycle. So nasal cycle is explained in Tirumantaram very nicely. So the nasal cycle is an ultradian rhythm. Now we study about that in the modern medicine, how the nasal cycle goes on. It's in 2 to 4 hours, it switches back and forth. But Tirumantaram, again, it has specifically said that in what days, what specific nostril is activated, and how is it important to use specific nostril for different types of outcomes. So those are the important things. And now modern science is now talking about how the Chandranadi, or the left nostril, is associated with the relaxation response, whereas the opposite is true for the right nostril, and the importance of doing the balancing exercises and so on. So it is a very interesting book, a lot of science in it, and we should be able to understand that in the way that we are able to reflect on some of the poems. That's where I like the Tirumantaram in a way that kind of opened an area, opened an experience for me that I was able to kind of follow on. So that's what is I like Tirumantaram about. It is also important to kind of follow the tradition along. Sometimes the poems said in Tirumantaram cannot be just understood all by itself. So, but when you go through other poems of other siddhas, like we have Padinan Siddhargal, 18 Siddhas, and several other Siddha poems. So if you go through those poems, you will be able to understand you'll be able to correlate those, okay? And had, today's sedentary life, people had, okay, so definitely, one thing I want to, kind of specifically say that pranayama is not a medicine. Pranayama alone is not a medicine. Anything alone is not a medicine. You had to combine so many different types of approaches, and pranayama will help in kind of better breathing. It'll help you to stimulate some of the tumor suppressors. It will help you to kind of reduce stress. Maybe if you're taking, kind of drugs, it will help you to reduce or work coherently with the drugs, and it can work with the radiation or fears of radiation, how that could be useful in kind of breath holding maneuvers during radiation therapy. All that things can be possible, but what you should remember is that everything is an adjunct therapy. Pranayama is an adjunct therapy. We have to take it along with other standards of care. So I would say that pranayama will be helpful, but at the same time, You cannot drop all other methods of treating oneself. This will be the same for all different types of issues, problems. And then it is also like depending upon the stage where you can definitely prevent a lot of these diseases by constant practice. Number one, it is because of the reducing the infection, providing the right molecules to the right places all throughout the stage. You stimulate that, and after some time it comes down, that particular molecule can come down and then re-stimulate it. So that's how you have to kind of continuously practice. So it's very important. Mm. Okay, and oh. Some of my friends are here. Muru, Ariva, thank you for being here. Very supportive. Yes, pregnancy. Very, very interesting question. Sure, pregnancy. It's definitely it's a breathing regulation is an important, kind of a technique, or it is important to learn proper breathing techniques, breath hold techniques for the pregnancy. And what you also do is like when you start doing that before pregnancy, you are helping the system in so many different ways. For future, in postpartum, people are having depressions or high stress that will lead to reduced lactation. So in all those cases, what the relaxation response will be helpful in dealing with some of those effects or the negative impacts. So you definitely want to have these exercises. You don't have to always think about pranayama as a person sitting in a posture and then doing all these things. Not necessarily. You can do pranayama by simply chanting, different types of chanting. You can do singing, different, whatever the song that you like to do, try to connect it with the breathing. So, Anjuvadanjame Pedamai Anjuvadarivaturil. You can chant Tirukural. You can, that's what is going on currently in the end on the other side. So we have a Tirukural session every Sunday at this time, exactly during this time. It just ended. So we can use chanting. That's what the chanting is pranayama CD about. Chanting is a way of pranayama. Talate, tal is nak, the tongue. How do you move the tongue around? That's how we practice pranayama in that scenario. So pregnancy and polycystic ovary disease syndrome. So those are the types where people will be, they can use some of these pranayama methods. And urinary bladder dysfunction, there will be a lot of those issues after childbirth. You can use, when you're doing these regular pranayama practices, you'll be able to have a better ability to recover from that. Pure positive head to okay. Yes, definitely. There are these exercises are very relevant for today's mindset for people with different stressors that are affecting their normal life. These exercises will be very important in regulating our emotions or changing our emotions to a positive side. Where do we keep our desires? We store our desires in our breath. We store our burden in our breath. When you feel that when your breathing is heavy, which indicates your mind is heavy, your heart is heavy. When you are able to breathe, think about times when you laugh with your friends, family, and have a good time. After that, what do you do? That's very light feeling, right? Manam lesa அப்படின்னு சொல்றோம். So when you have that feeling, that is what is pranayama is bringing inside you, your ability to reduce the burden in the mental status. So that gives you a positivity. And specifically, there are exercises you can think of that will be activating the Sudarsana chakra, or the solar plexus, the Manipura sacrum, right? So in the abdomen. Right, so when you are activating those areas, this is kind of the second brain, the Manipura chakra. That's a place of our willpower. When you are able to kind of stimulate that chakra, you'll be able to improve the communication with your upper chakras. That's basically the cervical, like the plexus and the Agnya chakra or the Sahasradalam, though all can be nicely stimulated, right? So this improves the flow of your normal flow of information. So that's nothing to do with magical things like, okay, my energy is racing, all those stuff. You can experience, you can imagine however you like. But it is important to understand that everything is connected to the neuronal pathways, and all the neurons are kind of, they can communicate with each other. One releases things, the other one takes up thing. Uh, so it is always a great communication. So you will be able to um, use that communication through the breathing, because manmanam yengundu vayum angundu. So where you put your mind, there's your wherever you put your breath, there is the mind. Wherever you put the mind, there is the breath, there is the energy or the life force. Good. So definitely, if you do pranayama, you can feel that difference in how you are able to eliminate some of the uh, thoughts like stale air. You're able to eliminate some of those junk that's up there, and then um, get some fresh energy. ADHD, yes, again, definitely ADHD or autism spectrum disorders. In all these cases, this will be very helpful. There are some kids that I have, given advice to how using simple exercises like chanting, so chanting Om or just humming, that helps them to relax. So exercises, definitely the physical exercises are a great way in childhood um, uh, syndromes, but it is also important to incorporate some breathing exercises. But you have to be very careful in what they can do and what are the things that get affected in their system. So there should be always a good, need to be good balance in that. Very good. Are there any further questions?
Um, yes, sir. I think we still have some questions, but shall we answer them, sir?
Yeah, go ahead. Yeah, yes, sure.
So I think there is one personal question like I personally have migraine headache, so it's very bad. So can I have relief because of pranayama?
Yeah, definitely. As I mentioned,
Yeah.
these are the things that pain-related chemicals that can be reduced over time with the practice. So you will be able to reduce some of these effects of this perception. Pain is half mind, half body. So you will be able to address those by breathing exercise, because the brain, the breathing can talk to both sides, the physical body and then the emotional body. So you'll be able to address some of these. But as I said, it is not a magic. So pranayama can be a magical thing, but it is also, don't expect everything can be cured by pranayama. So take it through your personal experience, through constant practice. The constant practice is something that you definitely need, like just like any athlete that is that's going through rigorous practice to go to a competitive sports. It's the same way. You should have the proper tools, proper techniques, and then proper training. That will help. And going to before going to bed, yes, definitely it will help you to sleep better. Some pranayama. Don't as I probably mentioned 50, at least 50 different types of pranayama. There are slow breathing exercises. There are fast breathing exercises. You have to make sure what type of exercise you do at what time. So you maybe want to go to bed and you want to sleep, do exercises that will calm you down, right? So when you want to be active, you do that exercises that you will be doing to stimulate you. Those are the fast breathing exercises. Prana Science is a good yoga book in English. There is Swami Rama's book, P.K. Iyengar's book. You can read many of those books in English. Children with ADHD, I addressed that. Autonomic response to breath holding. So yeah, so this is the how you will be whenever you are holding the breath, right? There are so many things that are happening. So when you're holding the breath, you are improving the level of carbon dioxide in your system. So the carbon dioxide is the one main sensor for the breathing autonomous nervous system to respond or kick in or regulate the breathing response, the ventral and the dorsal respiratory ganglion. So it is important that based on that carbon dioxide level, these responses will be kicked in. So when you have breath hold going on, so you have a breath hold, whether holding it out or holding it in, what you're doing is you're elevating the level of carbon dioxide. So that carbon dioxide level elevation will try to open up the arteries. At the same time, it'll kick in the intention to breathe in. So there's a connection. So always, both the sympathetic and the parasympathetic, they always like compete through the neuromodulators. So those neuromodulators will be acting on individual target organs also. So that's why it's like there is not, it is not only the top-down approach. So its brain is not always the thing that is instructing the breathing to regulate or those autonomic controls. You can give a reverse signaling, the feedback from, you can regulate the breathing and give a signal to the brain to change its activity. Yeah, that I can show you real quick any single activity that I would like to learn. I would just go through, yeah, for weight loss, COVID patients, yeah, so the COVID-19 patients, there are, as I mentioned, the exercise, this Tirumantaram pranayama itself is something that can stimulate some of the antibodies that people have reported for COVID-19 immune response. On top of that, the government of India, Ayush Ministry, the government of Tamil Nadu, they have suggested use of the exercises like Bastrika or the Brahmari pranayama. So those are the important exercises that I can share, that the humming, very easy humming practice. Weight loss, definitely. That's what the healthy Charleston challenge is. That I was showed you in one of the slides. It's a healthy Charleston challenge is about weight loss program. So again, this is a very prominent way of altering your metabolism. You can improve your metabolic activity, you can decrease your metabolic activity based on what type of pranayama you do. And it also can change the way you eat, right? So you can reduce food craving by doing some pranayama before you eat. So try to do some 10 minutes of pranayama by doing some breath hold exercises. That will reduce your craving. And it also can stimulate some of the factors that will be kind of easily help you to feel satisfied. So you will not be having more food. So everything, it's like a fine tuned balance of all different types of activities. And one feeds the other. So it's all like nicely coherent and coming into a good balance. And the Brahmari is a very easy exercise. You don't even have to hold it like this. Like this is the normal way people hold you just close your eyes, close your ears, and you keep it like this. And this is a mudra called the Arumukha Mudra or the Shanmukhi Mudra. So you can close and then take a nice deep breath in, filling the tummy, the lower ribs, upper chest, and nice deep inhalation, and then hum out. You don't have to kind of cover the face or close your eyes like that. You can simply do the humming. When I'm sitting long time on my on the chair, I like to do the humming exercise because it helps me to kind of focus a little bit more and reduce the stress. I may not be able to completely mindful about my breathing, but at the same time, it will help me to regulate the breathing, at least the physical level. So it is very good. I'd even, you mentioned trigger. Yeah. Anyway, generalize this, which makes brisk. Yeah, so it's one of the ways is to understand is that how fast or slowly we breathe. So mainly the exercises that activate you will involve some breath holding or faster breathing maneuvers. So in some of the breath holding exercises, you'll be quickly inhaling, fastly exhaling, and then holding the breath. All these things can activate these, factors that will be making you more brisk. So when, on the other hand, very slow exercises, like the some of the exercises like the ocean sound or the Ujjayi breathing, or even the stepwise breathing, very slow three-part breathing, they all can keep you feel calmed. So it is basically like a toolbox. You can choose, how do I feel right now? So sometimes we like to eat mango. Sometimes we like to eat some other stuff, right? The craving changes. In the same way, when we have a good awareness of our body or mind, then we can choose the right pranayama practice. Okay, I feel sleepy in this afternoon. I want to kind of I need to do some more work, get some motivation. I have a different tool. I have a different pranayama to improve my energy level, to improve my enthusiasm. So it is working both at the level of the mind and in the body. So you can choose very in a very very varied manner. Surya Namaskar in a day. So sunrise is once in a day. So I think you can do I personally, I would prefer that for each side, I would prefer a minimum of 3. So which will be 6 sun salutations and 6 rounds of sun salutation. And it is also like, even if you do 1 round of sun salutation with a deeper or longer stretch, that in itself is good. If you're able to stay in individual pose, at least in each pose, at least for 2 minutes, that is, even if you do that 1 round, that is good for that particular day. You can do once in the morning, once in the evening, that's fine. But mostly the sun salutation is that it is not only for the sun that's outside, it's the sun inside. It'll be nicely regulating all the different chakras, raise all the different chakras in the system. And sorry, let me put this in silent mode. Excuse me. So the definitely you will be able to do that for at least a few rounds every day in the morning or evening. In your 37 methods book, this categorization is documented. Yes, there are some, there are some papers that talk about, say, for example, Brahmari is a slow breathing exercise, Ujjayi is a slow breathing exercise. There are some studies by people in Pondicherry, Balayogi, Bhavanani. He has done some studies on slow breathing versus the fast breathing exercises. In the fast breathing, Bastrika, Kapalabhati, all those types of exercises are fast, whereas these slow breathing, Ujjayi, the regular Dirgha Swasam, those type of are the fast breathe, as a slow breathing exercise. The 37 methods book, yes, if I would indicate those places. In every single exercise, I would be adding whether it is a fast or slow breathing exercise, what are the different speeds in which you can do these exercises, how to do, what are the precautions and contraindications. So everything is explained in that book. Yeah. Very good. I really enjoyed talking with you all today. And I think I have another meeting coming up in another 11 minutes. So I should be, saying goodbye. I really like talking with you.
Thank you, sir. Thank you for the wonderful presentation, and thank you for sparing your time. And it was really useful for most of them. And I think really they will take a step forward to practice this in their life, get benefited, and also share the good news with all the community.
Very good. Thank you so much. Thanks for organizing this. Thank you, everyone. Vanakkam.
Thank you, sir. Thank you.